Well, early detection is, absolutely life-saving when it comes to cancer and many other serious diseases as well. If you catch a condition in its earliest stages, it's often more treatable, it requires less aggressive therapy, and it leads to better survival outcomes as well. And really, it's not just about medicine, it's about time as well. Time to make informed decisions, to get support, and explore treatment paths as well. So it really opens the door to a lot of preventative action. And if someone learns that they have early signs of a chronic condition, let's say it's even diabetes or heart disease, they can make those lifestyle changes early to prevent that progression altogether. So that's very powerful.
And what types of screenings or tests should people be more aware of? And when should they start taking these tests and these screenings?
Right, that's a great question because knowing what to screen for and when is one of the most effective ways to protect health. Really, what I would suggest is in your 20s and 30s, you'd want to focus on mental health assessments. You'd also want to check your blood pressure and sexual health screenings. If you're sexually active, regular pap tests for cervical cancer would also begin typically at age 25. In your 40s, that's when your cholesterol and diabetes screenings are going to be very helpful. A fasting blood glucose test, a cholesterol or lipid profile can really help identify those early signs of cardiovascular disease. Now, at age 50, and some people debate starting these at 40 as well, is we add additional cancer screening. So Canadians are recommended to begin colorectal cancer screening at age 50 using an FIT test, which is done oral colonoscopy as well. For breast cancer, women aged 50 to 74 should have a mammogram. And again, we advocate that this may need to be pushed further down to age 40. For prostate cancer, screening can be more nuanced, but on average, men over 50 should have that discussion with their doctor, especially if they're at higher risk because of family history. And then finally, lung cancer screening. So if you're an adult aged 55 over and you've had a history of heavy smoking, it may be a good idea to speak with your doctor to look at a low dose CT scan as part of lung cancer screening.
And how much of a difference can early diagnosis really make in terms of survival and treatment outcomes?
Well, early diagnosis can really make a profound difference, not just in survival rates, but really in the entire experience of treatment and recovery. So, what we do know is if we find cancer or other serious diseases early on, they're often much more localized, which means they haven't spread to other parts of the body. So, that can allow for less aggressive treatments and also increased chance for long term survival. So, in Canada, the 5 year survival rate for breast cancer diagnosed at stage one is nearly 100%, but it can drop to 23% at stage four. Similarly, for lung cancer, which is one of the leading causes of cancer death in Canada, the survival rate at stage one is 61.5%, but just about 3% if we look at stage four. So those are huge differences that we would find only with early screening.
And are there specific groups who are at a greater risk of a late diagnosis, and why would that be?
Yeah, so we do see specific groups in Canada which face, I would say, greater risk for late diagnosis. A lot of this can be due to system inequities, access barriers, and social determinants of health. So people living in lower income communities, for example, often would experience delays in diagnosis because they may lack the access to primary care providers, transportation, or even paid time off to attend appointments. We do know that Indigenous populations can also face significant challenges. This can include, geographic isolation and limited healthcare infrastructure. Certainly, newcomers and racialized communities can encounter language barriers, cultural misunderstandings as well at play, and that can all create a big barrier to access as well. And then we shouldn't forget, although it's been a while, the impact of COVID-19, which actually disrupted screening services across the country. And some provinces in 2020 actually saw a 40% fewer cancer screenings because of the pandemic.
And what are some of the most common warning signs that people often overlook?
Now, so many serious illnesses will sometimes start with very subtle symptoms, symptoms that you might dismiss early on there. Unexplained weight loss, so losing weight without trying, a persistent fatigue, not just feeling tired, but this deep ongoing exhaustion. Changes in bowel or bladder habits, sudden constipation or diarrhea, for instance. Skin changes, so a mole that changes shape, color, or size. Persistent cough or a hoarseness. Numbness and tingling in the hands and feet that can't really be explained. difficulty swallowing or speaking, and lumps or thickening, especially around the breast, the neck, or the axillae as well. So the key here is to know your baseline, know what's normal for your body. And if any of these things occur, just have a conversation with your doctor. It doesn't mean it's bad, but it's worthwhile discussing with your doctor.
How can public health systems improve outreach, especially in rural or underserved areas?
That's a great question. So, improving outreach in rural and underserved areas, I think it requires more than just sending resources. I think what we do need to do is listen and have local partnership and really tailored strategies that reflect the realities of these communities. So, instead of a one size fits all model, which can usually be the easiest way to do things, usually what we're looking for is community driven, culturally sensitive, and accessible. So, a very powerful approach, by example, is investing in mobile health units and telehealth services, which can bring care directly to people who live far from clinics or hospitals. These types of models have shown actually a lot of success in different parts of Canada, especially during the pandemic when virtual consultations really helped bridge these geographic gaps. So, for telehealth to work, we really need to ensure reliable internet access, which still remains a challenge in many remote regions.